Good morning, everyone. Welcome to our second webinar in a three-part series titled Empowered Peel Communities. Today's webinar specifically is titled Responsibility in Reporting on Systemic Racism. And I will be your host today, and I look forward to speaking with you on this topic. Before we begin, I did wish to do a land acknowledgement. This is very important to us across all of our partners and organizations involved. We want to acknowledge the land on which we're on, to understand those who were here, those who still are here, and their value both to this conversation and to the greater community. We acknowledge that the land on which we gather and which the PMC operates is part of the treaty lands and territory of the Mississaugas of the Credit. In particular, we acknowledge the territory of the Anishinaabeg, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit, which would have included this area, Peel Region. We have a large team, some great partners that have made this project possible, and you'll see them listed here. Our project funder is Canadian Heritage, and Peel Multicultural Council is a lead partner on this project. Naveed Chowdhury is the executive director. Jagdeep Kali, who I believe has joined us now, is Settlement Services Manager. Linda Wang, who you can see in the gallery, is Community Connections Coordinator. And myself, I am a consultant with this project. My name is Rahul. We also have members from Amplify Engagement here with us today. They are the other core partner in this project. We have Saskia Kwan, you can see in your gallery, principal, as well as Janine Paul, principals at Amplify Engagement. And we also have Fatima Khan, who is communication specialist in supporting this project. Before we get into the, the nitty gritty, the real content here, we wanted to share some housekeeping rules, some feedback and suggestions to you. We encourage everyone to speak up and share. This isn't just a webinar in the form of a presentation. We really want to collect your suggestions, your ideas, and your experiences. Please keep your comments and feedback in the chat respectful. Our panelists are able to hear from you at any time. You can also put questions in the Q&A throughout the webinar. And so if you look at your toolbar, you'll see a section likely beside the chat, which says Q&A, where you can contribute your questions, but also just statements, comments, and feedback. If there's anything at any time that doesn't make sense or is confusing, maybe there's problems with the audio or video, please let us know, and we're happy to repeat or clarify. The webinar portion, which is taking place in the first half, approximately about a half hour, that portion is being recorded, and that will be shared on the PMC YouTube channel for other members of the community who couldn't join us today. We won't be recording the Q&A portion. We want to make sure you feel safe in a space where you can share your feedback with us, which we can note down and collect, but it won't be shared as part of any recording. Okay, let's talk a little bit more about the project, as for some of you, this might be the first time you're hearing about this project, which is underway. So the project, or the Anti-Racism Project as it's known, is really looking at what has taken place in the period of time of the pandemic so far. The media and public have often described Peel communities, unfortunately, in this time in racist and stereotypical ways, and this has changed over time as well. Evidence has shown higher rates of COVID-19 in Peel were not because of some of the preconceived notions, but as a result of different inequalities and injustices locally. So this project is meant to empower community members to share their perspectives about the racism they may have seen or experienced during the pandemic, challenging these false narratives and looking at solutions for different members of the community. Today, we're looking specifically at reporting, so those who may report, such as members of the media, government, etc. This webinar series is sharing reflections from community members, and these are community members in Peel Region that we had a chance to speak to in 3 different focus group sessions on why these racist representations exist, why they take place, and what changes the community wishes to see for a more equitable and respectful society. I wanted to share with you some of the questions we had asked the community in these focus groups, and this helped inform some of the recommendations which have come out since then, which we'll also be sharing today. The first questions we were asking were there any stereotypical and racist behaviors, attitudes, or media stories that led you to believe that minority or racialized communities were overly targeted during the pandemic? And again, as a reminder, we're looking at this within the context of Peel Region specifically, but with lessons for a larger area as well. Moving from that question, we then asked what could have been the reasons for these types of depictions by various community members, various reporters, various agencies. And from there, it was moving towards solutions and change. What needs to change for Peel communities to be fairly represented by the public and the media in the future? What do people in a position of authority need to better understand about minority or racialized communities in Peel Region? From these discussions which took place, we had a lot of best practices, ideas, and solutions shared. Here's what we have been hearing from the community. The first area of focus we wanted to talk about was what is described as the hotspot of Peel Region. And you can see here in this graphic from the Toronto Star, this was a very common thing we saw on a week to month to year basis. How are the cases changing in the local areas? And for better or worse, Brampton was very much in the hotspot in the news as well, not just in the reporting of locations with case counts, high case counts. Among community members, some of the things we heard was inaccuracies in information. Examples were given that census data was not tied up to date with case data. So there might have been a higher concentration shown on a map, for example, because older census data, so a lower population, was correlated to the current number of caseloads. So different years of data for the same reporting. Community members also spoke to exacerbation of existing stereotypes. So this spoke to how certain communities, for example, the South Asian, Chinese, or Black community, was already facing different levels of discrimination from media, from local authorities, from health agencies, in how they might have been treated, delivered services, or what access to services they did receive. When communities were highlighted as a hotspot in this particular situation during the pandemic, it often further increased the distance between access to services and fair treatment from fellow members of the community. It felt like there was a growing divide between what was being reported and what was desired to be actually discovered and shared about how these communities were struggling during the pandemic. Members of the communities we spoke to in the focus group shared that they didn't feel their community's actual voice was represented in some of the mainstream, some of the larger media outlets, which were sharing stories and were often the main source of information for a larger and larger population that was looking for immediate information, up-to-date information. For many of these communities, these sources of media were important to them too. But as they saw more stereotypes, for example, represented towards them, it reduced the trust and desire to use these sources of information. Something else which was shared was highlighting local communities, for better or worse, did not always come with solutions based on what the community desired. For example, when communities in Brampton in the industrial sectors that needed to stay open were highlighted as having high case counts, there wasn't always the follow-up of what are the gaps that are leading to these high case counts? What is the support for PPE in one community as opposed to another? And who is not receiving the supports that they need that has caused higher case counts? Examples were given that they would simply say, this is a problem, and these are communities in effect to blame for high levels of COVID in the community, as opposed to these are the resources missing that is increasing the case counts in some of these areas where businesses such as warehouses need to stay open to support the very services such as production of PPE or delivery of goods for the community. I believe this is the last point here, the negative outcomes of reporting. And this spoke to the exacerbation of stereotypes shared earlier. For many in the community, when they saw reporting, they found it not just to be information, but information which further dissuaded support for local businesses, the treatment of individuals, so those who might have already been facing stereotypical treatment or discrimination, were now facing a higher scale of it. An example was, which is reported by the media as time went on, Asian hate or hate crimes towards the Asian community. From this area of focus, I should say, towards some of the concerns and challenges, we asked the focus groups, what is the cause of this and how can the situation be improved? Again, tying to the legacy of stereotypes, there is a legacy of discrimination that was highlighted. For the community, they feared that the more information that wasn't shared about the local culture, for example, the tendency for Chinese community members to wear masks, regardless of if there was a mask mandate, would lead to longer-term discrimination that would further worsen existing stereotypes on the community. When negative press was generated for the community members in regards to high case counts, many in the community feared this will lead to long-term treatment of these community members as being less healthy, less sanitary, less desirable community members to interact with. Many individuals feared that this could also be an impact to having access to jobs, for example, for newcomers, many of which were reporting the struggle to be able to get employment based on their experience level, their expertise, or their amount of time in a certain workforce or industry. There's a lot of positive shared too, and we're going to continue to share that as the webinar progresses. The importance of collaboration to get the local story, the local nuance, was highlighted multiple times. When many feared there was misinformation shared by the media, stereotypical narratives, judgments, or labels, they believe a solution could also have been greater reporting on the ground, hearing from local members of the community, and working with community members in some cases to encourage them to share their own story. For example, opinion pieces, editorial pieces, or storytelling narratives that can be larger stories, such as part of an investigative journalism piece. Consistency was also mentioned across some different areas of feedback. And what this was looking at was, again, who is generating the story and how does that story change depending on the media outlet? Or again, for reporting, this includes different levels of government. There was often a different narrative portrayed depending on which outlet or which individual was speaking. So members of the community wondered why there was sometimes different perspectives, different levels of focus, for example, on healthcare from local politicians versus local media versus local health agencies. Community members wanted to see more consistency on what were the challenging problems in these communities in terms of access to resources and what are some of the solutions. So ensuring that community voices are captured and that the different agencies reporting are sharing the same complete story. Access to key data goes back to that original visual we showed for hotspots. The main piece of feedback that was shared here was there is a lot more depth to what we see in the community than what the case counts alone portray. And so the example was given of census data not being tied always accurately to the case counts in terms of the density. So what is the actual population on the ground and how has that changed through the pandemic? For example, more dense communities in certain areas because of work obligations, such as in Brampton. Increased workforce within the warehouse sector as more jobs were required to manage greater desire for deliverable goods. And the shifting nature of populations as access to healthcare, access to work, and access to safe spaces to live changed in the period of the pandemic. This was particularly true in Brampton, which was mentioned a number of times based on how they were negatively portrayed, but also highly desired for production of resources and goods. So again, going back to the industrial areas where it was often reported there were the highest case counts. This ties specifically more to media, which was quality over quantity. There were concerns that often the media, for better or worse, feels an obligation to report rapidly short and simple stories to maximize eyes on the news, to maximize the amount of clicks, likes, and shares of the media. And we know to an extent that this is required of the media, but there was a fear that this was sacrificing some of the deeper investigations, some of the ability to connect with the community and to represent community voices. The amount of depth which would be required to increase scientific cultural literacy. What are the terminologies and terms that maybe certain members of the community won't understand in the type of reporting they're hearing? So for example, was there access to reporting in multiple languages? Was there perspectives from those in the local businesses where there were high case counts? And was there an equivalent amount of reporting on solutions, or was there more reporting on this is the bad news, which may have led to fear and negative health outcomes or stress among the community? This point, which was quite often brought up, also tied to how negative reporting tends to automatically get more coverage because of social media algorithms. And there was a risk or danger that misinformation was unintentionally spread even faster due to otherwise regular, reputable reporting of information that had an angle of furthering a stereotype in the community. Again, the label of hotspot was mentioned. I will add one more thing, just going back here. I thought I had one more point there, my apologies. There was a component that was also shared, which goes across these points around a lack of understanding of the uniqueness or the unique challenges within Peel region. Peel, like some of the surrounding municipalities, is highly diverse. And community members noted there are many more individuals in these cases that are living in large, diverse communities with a number of what are considered essential workers during the pandemic. So these could be healthcare workers, educators, and workers within the industries that have been mentioned. For example, delivery of goods, production of PPE, personal protective equipment. There was a mention of messaging did not always reach the communities that were most vulnerable or that were facing the highest case counts. And considerations didn't include some of the unique aspects, for example, of family structures and high density housing, financial challenges, and the unique challenges of newcomers and immigrants, particularly those who joined Peel Region during the time of the pandemic or were looking for new work during this period of time. Multi-generational housing was also mentioned, and the challenges of being able to or not being able to isolate and recover if one was facing COVID-19 illness. Community members felt like these local nuances were not captured within the media, particularly the day-to-day media, which was most often consumed. So let's talk about some of the solutions and ideas which were shared. The title here is a little redundant, but we found it was the best way to capture some of the solutions. What is the responsibility of those reporting, be it in media, in government, or different local agencies? Something that was highlighted from community members that were spoken to in these focus groups was greater accountability. Within media, we often do see an area such as at the end of an article or in the front of the newspaper, which highlights briefly gaps and errors in reporting. However, community members felt like it wasn't always made clear when mistakes were made and what was the consequence of those mistakes. For example, misinformation around how a community is portrayed or the impacts of a label such as hotspot. What are the long-term consequences of these labels? There was a concern that when a fairly innocent response was shared in social media and amplified to portray communities in negative light, that media did not do enough to quote unquote set the record straight and verify which information is reputable and meant to be reshared and which information has been reshared for nefarious purposes. So for perpetuating hate or stereotypes towards a community. When there were gaps, for example, census data and COVID-19 case counts, the community did not see that highlighted, nor did they see it highlighted across different agencies. A greater focus on education was a broad recommendation, and it cut across different areas of focus as well. I'll just animate these through here. The first was, again, trying to capture those community voices more. And as the pandemic progressed, we saw more of this emerge. And so this was a recommendation community members wanted to see moving forward. Not just hearing local voices as to the challenges and solutions, but also highlighting opportunities for members of the community that might not have had access to resources in previous reporting. So an example was given of multilingual resources. Is the story being told in the different languages that the community is typically consuming information? Or the most vulnerable community members who may not have access to translation capacity or the information in English? The second area of focus in education was cultural literacy. And this was less about helping the community themselves and more about helping those who may otherwise assume or perpetuate a stereotype outside of these communities. So those consuming the media or the reporting by different agencies. In cultural literacy, the community noted that there's great pride in the diversity and multiculturalism of these areas, such as within Peel Region, but there isn't always the reporting which reflects that positive light that is given. Communities that we spoke to highlighted that there needs to be learning between groups that might be considered more established and those who may be newcomers, new immigrants, or Canadians, as it was described, so that people understand, for example, why is masking commonplace, or just understand that masking is commonplace in these communities, why certain types of workforces need to stay open during the pandemic and how that could lead to inequities in access to isolation, health, and healthcare resources during the pandemic. And this fed into access to equitable resources during the pandemic within and outside of the community. Some examples were given that was the most common were the ability to safely isolate and recover from COVID-19. there wasn't always reporting done on this gap in access to resources, which could have helped explain why there might have been higher case counts in certain parts of Peel region. There often also wasn't easy access to community care or local healthcare initiatives. And again, this came back to, were these resources available in different languages, in local businesses, in areas where the community was typically used to getting local information. And from here, the logical feedback that was given afterwards was improving that accessibility to information. So not just in more multilingual formats, in deeper dive, longer news pieces, which explain the challenges, the stereotypes, and the reality on the ground, but also greater information on what is available in public health. So greater consistency between what is being reported among health agencies and ensuring that the public gets that information from the media as well. Because as it was noted often, everyone isn't having the same access to the information that they need. So almost, and this would be myself, I guess, embellishing here, but almost asking for redundancy, asking for the same information being repeated in different areas. So for example, there is that consistency that was suggested by members of the community. And the long-term consequences or opportunity. It was so often noted that there are already many established stereotypes, for example, in the Chinese, South Asian, and Black community, which are already affecting community members' abilities to be healthy, stay connected, and have access to resources free of discrimination. This could include goods and services, but also healthcare. There is a concern that if recommendations are not taken, if there isn't a change in some of the reporting which was done, that these stereotypes will continue to grow and worsen existing divisions which are seen within some of these communities. And so we're very pleased to share some of these stories from community members, some of the themes that they highlighted to us with members of the media, with different agencies which are reporting on the pandemic and moving forward on various issues for public health and well-being. Well, thank you to everyone for listening in, for considering the suggestions and ideas that have been brought forward by the community so far. We really appreciate your time. We have a lot of ways you can keep in touch with us. Just like we were suggesting as that example given, if the media puts out that email address, you can connect with us in many ways. Of course, the Peel Multicultural Council website, you can find the general email there as well. Here you can find the social media tag and hashtag where we will try to amplify as many of the voices, the feedback, the comments which are shared with us. I want to thank everyone for joining us today in the morning. Thank you if you took some time from your work. Hopefully you took a little bit of a break. We hope you could join us in the most fulsome way possible. And thanks again to our partners in this project that make it possible. Peel Multicultural Council, Amplify Engagement, and our funders at Canadian Heritage.